Today we are going to see about embolism and pulmonary embolism in detail. So, what is embolism? Embolism is a process in which there is obstruction of some part of CVS by an emboli. That process is known as embolism. So, the obstruction can be partial or complete, and depending on which part of CVS is obstructed, it is named differently. If pulmonary arterial tree is affected, then it is known as pulmonary embolism. Obstruction by emboli. So, what is this emboli? Embolus. Embolus is a detached intravascular solid, liquid, or gaseous tissue mass which is carried by blood from its point of origin to a distant site. This is important. Point of origin to a distant site, it is carried by blood, and where it will leads to infarction or tissue dysfunction. That is embolus. So there are different types of embolus like air embolus, fat embolus, amniotic fluid embolus, and accordingly there are different types of embolism. First and most common is thromboembolism. Embolism is due to detached thrombus. So there are two types of thromboembolism. One is arterial and second is venous. In venous, most common is pulmonary embolism, which we are going to see in detail. Second is fat embolism, then air embolism or amniotic fluid embolism. Now we will study about pulmonary embolism in detail. So what is pulmonary embolism? Pulmonary embolism is a form of venous thromboembolism and leading to obstruction of pulmonary arterial tree by thromboemboli. That is known as pulmonary embolism. The obstruction is in pulmonary arterial tree, and it is the most common and fatal form of venous thromboemboli. It is a form of venous, and most common cause is deep venous thrombosis. Most common cause of pulmonary thromboembolism is deep venous thrombosis. So this is the definition of pulmonary embolism. Now we will look into the etiology of pulmonary embolism. There are main two categories. First is primary or genetic, and second is acquired or secondary. In primary or genetic etiology, mutations like factor 5 mutation, again increased factors like factor 8, factor 9 or factor 11, protein deficiency like protein C, protein S. Then secondary or acquired causes is bed rest, chronic immobilization or myocardial infarction, atrial fibrillation, fracture of long bones. It is also one of the most common cause of massive pulmonary embolism. Disseminated intravascular coagulation, oral contraceptive pill use, sickle cell anemia, smoking. These are the secondary or acquired causes of pulmonary embolism. Now, what is the pathogenesis? How thromboembolism occurs? First, the fragmented emboli, it is carried by larger veins to right side of heart, and from right side of heart it will enter pulmonary artery vasculature. After entering pulmonary artery vasculature, three things can happen. One, if the emboli are large, then it will obstruct right ventricle or outflow tract, or if it obstructs the main pulmonary artery bifurcation, then that type of embolus is known as saddle embolus. Embolus at pulmonary bifurcation is known as saddle embolus. It is a type of massive pulmonary embolism and it can lead to sudden death. More commonly, what happens is multiple small emboli or shower of small emboli from single large mass. These get impacted in number of small blood vessels and which is resolved by body. These small thromboemboli, they are resolved by body. They are mostly clinically silent. And the third thing which can happen is paradoxical embolus. As the name suggests, there is some paradox in it. Mostly it is a venous embolism, so embolus must restrict in the venous system, but here the embolus goes to the systemic circulation or arterial system. How? The venous embolus, it passes through interarterial or interventricular defect and then it reaches systemic circulation. This is the paradoxical embolus. Now we will look into the complications of pulmonary embolism. As we have seen, most of the emboli are clinically silent. Almost 60 to 80% of pulmonary emboli are clinically silent. They are resolved by body by fibrinolytic activity. Second thing which can happen is acute right heart failure, also known as cor pulmonale. It happens when the emboli obstruct more than 60% of pulmonary vasculature. Third thing, as we have seen, is sudden death, and it occurs due to massive pulmonary embolism. Then another complication is pulmonary hemorrhage. So what is the pathogenesis of pulmonary hemorrhage? Emboli obstruction of small end arteries. It will directly lead to hemorrhage, and medium sized artery, it will lead to vascular rupture, and which in turn leads to hemorrhage. So hemorrhage is the next complication of pulmonary embolism. Next complication is pulmonary infarction. Generally, infarction does not occur in lungs because lungs have dual blood supply, one from pulmonary artery and another from bronchial artery. So if bronchial artery blood supply is also compromised, for example in left heart failure, then it will lead to pulmonary infarction. Last complication is pulmonary hypertension or right ventricular failure. It is caused by multiple small thromboemboli over time. So these are the complications of pulmonary embolism. So we have seen pulmonary embolism in following headings. First is definition, then etiology, then pathogenesis and complications. Thank you.